Hi, my name is Monique Alvarez, and the name of my community health project is Basic First Aid Care Review of Sprains and Broken Bones for Teachers, Staff, and Parents of Students at Longden Elementary School in Temple City, California. I'm going to take a quick moment to go over the definition of a community and what a community assessment is, as well as how this information is used. Herzing University defines a community as a collection of people who interact with one another and whose common interests or characteristics are for the basis of a sense of unity or belonging. A community assessment is basically like taking a pulse on a set geographical area to form a plan for addressing community health needs. The CDC states that community health assessments organize comprehensive information about the community's current health status, needs, and issues that need to be addressed. Temple City, California is part of a group of cities in the San Gabriel Valley in Southern California and is approximately 15 miles east of downtown LA. It covers 4 square miles and, according to the 2020 census, has a population of 36,494 residents. The residents are primarily of Asian descent, accounting for 62.6% of the total population, followed by white alone, which is 23%, and Hispanic or Latino, which is 19.5%. I'd like to discuss a few key components of my windshield survey next. According to the U.S. Census Bureau, the population density per square mile is approximately 9,123. The median age of residents in Temple City is 43, with 79.6 consisting of residents who are 18 or older, accounting for the majority. 66.8% speak a language other than English at home, with 52.3% Asian and Pacific Islander languages being spoken the most. According to the U.S. Census Bureau, between 2015 and 2019, nearly half of Temple City's residents were foreign-born. Next, I'd like to discuss a little bit about medical resources and facilities. The residents of Temple City are extremely fortunate to have many different types of healthcare facilities in our community. Services for care from head to toe can be found throughout the city. These types of medical facilities are for primary care, OBGYN, family planning, and pediatrics. There's also several elective medicine clinics as well as holistic medicine clinics. There's no urgent care centers. However, there's 4 hospitals with emergency room services located within a 6-mile radius from the center of town. These facilities are very easily accessible. They do not require taking a freeway, and they can be reached by city bus. Next, I would like to go over community resources. So community resources are highly available here in Temple City. We have a very active community center and recreation department that coordinates events for families to attend, for elderly hot lunch program, as well as after-school activities for school-aged children. There's also facilities that can provide outside referrals for low-income families that need assistance with groceries, for example, the WIC program or the SNAP food program. Lastly, I'd like to go over homes and schools. So homes in the area were built in the 1950s and are in good repair. There's a general sense of pride in the appearance of the homes in Temple City. The homes are all very well manicured, the lawns are well taken care of, and you can just see people really love living here. As far as the schools go, we have 3 elementary schools, 1 middle school, 1 high school, and 1 high school alternative campus. Next, I'd like to discuss community assessment data and how it all ties in. By assessing and evaluating population statistics in my community, I've been able to understand where there may be gaps in communication and translation of information. The community issue that was brought to my attention was presented by the community liaison at one of the elementary schools. This issue presented itself as a lack of knowledge in the care of sprains and bone injuries, with the primary issue being a language barrier. The this is of important relevance because we really need to understand our population, the population components, to try and ensure that teaching is as universally understood as possible. As nurses, we are responsible for cultural literacy and linguistic competence. Community partners and resources. My primary community partner is the community liaison, whose name is Diana, at Longden Elementary School. She's been instrumental in assisting in the quantification for the need of a first aid review event. She also has built rapport with the community, with the teachers, parents, and students at Longden Elementary. My secondary partner is Temple City Unified School District, and they will serve for helping me with policy and procedure in presenting, in distributing my flyers, as well as scheduling a time and date to have my review. I have several resources that I'll be utilizing as well. Some are local pharmacies and drugstores, as well as a general merchandise retailer like Target. And this will be for supplies that I will utilize for the review. Other resources will be utilized that are located pretty much online. So there'll be the American Red Cross and other evidence-based sites so that I can gather information to do my teaching for the review on the sprains and bone injuries. Based on my community assessment and the concern brought forth to me by the community liaison at Longden Elementary School, I have developed a community health diagnosis of risk for injury among Temple City, California residents with elementary school age children and elementary school staff related to lack of first aid care knowledge, communication, and language barriers. My devised community health plan consisted of 3 components. The first was to seek partners and assess resources for assessing my community health issue. The second was to coordinate a first aid for sprains and breaks review session. Lastly, creating and supporting documents to supplement at the review session. The first would be a multilingual survey to assess the comfort level regarding the subject matter. Secondly would be a multilingual flyer to hand out, and lastly would be a checkoff document to assess learning effectiveness of the material presented. Goals. I had 2 goals in mind when attempting to address this community health issue. The first would be for the attendees of the review session to show competency, and secondly, it would be reporting improved understanding of reviewed information via survey. So as you can see on the left-hand side, I have the survey/questionnaire. It's figure 1 and it's multilingual, so it's in English, Simple Chinese, and Spanish. And I use a numerical system, and then underneath each number from lowest to highest, it just rates from scared to confident. Proposed interventions for community health plan. The first was to develop a multilingual flyer, which you can see at your left-hand side, titled Figure 2. The second was to distribute the flyer at Longden Elementary. The third was developing a learning and evaluation form utilizing multilingual titled sections and simple graphics. You can see that on the right-hand side of the screen, Figure 3. You can see things are in English, Simple Chinese, and Spanish. Lastly, I provided translators at the review for any additional questions that the attendees may have had. Those evaluations for community health plan. The first goal would be to utilize a checkoff document that used the teach back/show me method, and that was seen in the previous slides as figure number 3. And the second was assessing if the comfort level in the tasks reviewed had improved. And that would be utilizing figure number 1, which is the questionnaire in different languages that the attendees were able to fill out. Ultimately, they did report an increase in comfort level between numbers 4 and 5, and they were really happy to have been able to attend the information session. This concludes my community health project presentation. The importance of communication and education is vital in addressing a community health issue. Assessment of the community and gathering of pertinent data is ideal in the development of a plan to address a community health issue. The formation of strong partnerships really makes a difference in the ability to address a health issue and have positive outcomes. Culturally competent materials and resources are one of the most important, if not the most important, components in implementing interventions for a community health project, because it ensures that your community is able to process and understand the information being presented to them, which in turn will help reduce the incidence of the community health issue at hand.